You jibber jab, bamboozle, nuka noozle, bippity bop, she-go. You jibber jab, bamboozle, nuka noozle, bippity bop, she-go. I mean, you keep on talking, but you don't.
Welcome to the weekend. I'm John Caldara, president of the Independence Institute. You're watching Independent Thinking. So, Obamacare right around the corner. Is it good for you? Is it good for Colorado? At the Independence Institute, well, we've got an opinion. And we did a few interesting little videos that we're going to share with you from the Independence Institute. Linda Gorman, who runs our Healthcare Policy Center, thank you for joining us. You know him, you love him, you miss him from the state legislature. State Senator Ken Gordon, you enjoying single life? That is the free life of being non-elected?
Yeah, I don't have to wear a tie.
You don't have to wear a tie. How does that feel?
Much better.
Much better? Yeah, well, you're giving up that big salary, too.
That's right. That's right. I went for another big salary as an adjunct professor.
All right, tell you what we want to do. We at Independence decided to take a few looks at different aspects of healthcare reform, and we thought, well, let's make a couple little animated shorts about it. So what we're going to do is take a look at those three things, and maybe they'll spur some conversation. The first one has to do more with Massachusetts and what they've done. So I tell you what, let's take a look at this first video right now. This is number one.
Many in Washington want to bring change to healthcare, but what kind of change? The same change as in Massachusetts, where they say whether you want it or not, you will buy health insurance. It's mandatory. But does this work for everyone? Take this doofus-looking guy. His name is Justin. He's in good health, loves to bike while wearing this completely ridiculous outfit. He buys his own health insurance. And if he lived in Massachusetts, Justin would be a criminal. You see, Justin opted for an individual, high-deductible insurance policy. If he gets sick or hurt, he pays the first $5 grand, and the insurance company picks up the rest. This keeps the cost low so he can afford it, but it keeps him covered in case he doesn't see that oncoming bus. The bureaucrats, however, think they know what Justin needs better than he does. The maximum deductible allowed in Massachusetts is $2,000, making the policies too expensive for people like him. Now Justin is forced to use taxpayer money in order to buy a policy he can't afford and doesn't want. Justin shouldn't be a criminal for buying affordable health care. He should be a criminal for wearing those clothes.
All right, so in Massachusetts, they put in a law that Obama's looking for, which is you will, if you can, buy health insurance. It's mandatory. And if you don't like what we're telling you to buy, too bad. It's going to happen. Now, this is part of the plank of Obamacare as well. What's the problem with that? Why is it you have a problem?
I have a problem because I don't think the government should be allowed to force me to do something like buy a product that I don't get to have any say in just because I breathe. There's no way to control costs when you do. And in Massachusetts, in fact, right now, what they're doing is they're starting to ration because it's become so expensive that everybody is saying, well, you got to subsidize me, so they do. And now they're saying, well, maybe we won't cover you if your illness is more than $100,000. So you have to buy the government-defined health insurance, but it's not going to be there when you get sick.
Now, this is something that came from a Republican governor. Mitt Romney did put this into effect. And
yeah, he took a lot of credit for it during the campaign.
Yes, he did.
And this was something he said, we're doing something different here, and you have to buy, if you live in Massachusetts, just by living there, you have to buy what they consider to be the right policy.
Yeah, well, I think the initial question you have to answer when you're looking at healthcare is, as a community, as the United States, do we think that people should be able to see a doctor when they're sick? And what happens, I think we've answered that question in the affirmative. We feel that, we're not going to make sick people not get health care just because they may be poor. And so we've answered the affirmative, but we've done it in kind of a way that shows our psychological problem with actually going that far. We don't give them access to a doctor until they're really sick, and then they have to go to the emergency room. So it makes people sicker, it causes high expenses, and so it wasn't very rational the way we came up with it. A lot of times when we come up with a policy, when we're torn, we come up with something that's not rational. But here's the question. What should you do if somebody shows up at an emergency room, they were in an auto accident, it's a young woman, they didn't bring her purse, you don't have any ID, you don't know if she's got insurance, you don't even know if she's a citizen, but she's injured. I think all of us say, well, we have to give care to that person.
And And I agree. I mean, we do give care to that person. Somebody by law cannot be turned away from a hospital, and I don't think that's going to change as much as purists would say, well, show me you can pay for this bill, or we'll leave you in the gutter. Why doesn't, I understand you don't like the idea of government saying you must buy this health insurance product, whether you want to or not, but the idea is that if you're young and you're healthy, you're not going to cost the system that much, and you can be paying into the system. And so if you wait until you have an injury before you buy health insurance, you haven't paid into the system. It's not feasible. So if we force you, healthy person, to buy it, it helps pay for those people who need it now. What's wrong with that?
What's wrong with that is many of the people who aren't insured now can't afford, people say, a policy given current rates. And so what that means is that, yeah, you force them to have a policy, but since they're too poor and everybody says so to have a policy, well, then we have to give them money so that they can buy a policy. So what's being proposed here with the individual mandate is going to end up costing way, way, way more than the hodgepodge system that we have right now. There's a lot of different ways to do this. For example, it costs about 3% of total national spending to take care of all the uncompensated care that exists now. That's about $70 per person who has insurance per year. That's not bad, okay? Everybody pretty much gets health care, and the people that want insurance to protect their assets get insurance. What's being proposed under Obamacare is increasing my insurance premiums by who knows how much, $4,000, $5,000 a year, so that people can be subsidized because they don't have health insurance. There are other ways to provide health care. The way we did it before health insurance was invented is we had public hospitals. If you were ill, you went to the public hospital. What we've done since then is turned things on their head and said, well, even if you're not paying, you need to be treated like everybody else. That may or may not be a good policy, but the point is there's other ways to do this than jacking up the prices for everybody.
Is doing what Massachusetts did, is that a good part of the Obama plan? Is that something that's a necessary evil, which is that mandate? You know, if you have a high deductible policy, too bad. If you can afford that, we're going to force you into the low deductible policy, whether you can afford it or not.
Well, in order to make this work, if we agree that health is a community responsibility, then we have to spread risk and we have to have everybody participating. You can't just let people be freeloaders. And so I think it's probably an unavoidable part of it. One of the big things that bothers me, though, about the current healthcare system is the large amount of money that goes into insurance companies that doesn't come out as healthcare. That seems like a big waste to me of hundreds of billions of dollars.
What kind of things?
Well,
you mean like that nasty profit thing?
Well, not just profits, but I'm not a socialist. You know, I think that the supply and demand curves and the free market system are great incentives and provide innovation. I don't oppose you on that issue. But let me give you an example. My girlfriend is the executive director of the Autism Society of Colorado. She has a son with autism. He has trouble speaking. His United Healthcare policy said that he should get speech therapy, but they always deny it because they say we don't cover autism because it's not a congenital anomaly. She gets a letter from a doctor saying it is a congenital anomaly. They fight with her. It's a $500 benefit. They fight over this every year for years. Meanwhile, William McGuire, when he left United Healthcare, got a $1.6 billion with a B severance package. Now, a lot of it was stock options, but what the board let him do was backdate his purchase date so he could pick a really low price date and then sell it when it's high. And you know, so he's taking $1.6 billion out of the economy, a lot probably out of healthcare, and they're denying speech therapy to a child with autism. That's a private insurance company.
Yeah, the government does so much better. You know, if you look at claim denials, Medicare is notorious, and so is the Veterans Administration. I mean, there's entire cadres of lawyers who do nothing but litigate against the VA because it denies veterans benefits. So it's not to say that things don't, that, you know, yes, the private sector screws up, but government screws up way more. And you can see this by looking at the government programs that are run in the US and the government programs that are run elsewhere. But beyond that, where does government get off telling me that instead of a $7,000 deductible, I have to have a $1,000 deductible?